Hi, this is Peggy with Natural Awakening Chicago Magazine, and I want to welcome you back for another video in our Women in Wellness series. All this month, we've been talking to prominent women healthcare practitioners and women in wellness businesses in the Chicago area. And today I'm pleased to be talking with Dr. Bernice Teplitsky. Dr. Teplitsky, or Dr. T, as she likes to be called, is with Wrigleyville Dental in Chicago. So welcome, Dr. T.
Thank you. Thank you very much.
So Dr. T, I'd like to get started talking a little bit about what are some of the differences maybe between a holistic or biological approach to dentistry and maybe a more traditional dental care.
So there are many differences, and we're called different names. So we can be called holistic, biological, integrative, natural, biomimetic. There's many different names that people call holistic dentistry, and there's a big spectrum of practitioners too within that spectrum. In our office, we like to take a look at the whole individual. So not just treating the teeth, but treating the overall health as it relates to the teeth.
Mhm.
So we look into what types of materials are inside the patient's mouth that could be negatively impacting their overall health. So it could be from metal testing, mercury testing, root canal testing, taking a look at a three-dimensional x-ray of everything going on in their mouth. We can look at their joints, we can look at their sleep health, different types of materials that are in there. So sometimes patients aren't compatible with the materials that are in their mouth, and they could be giving them systemic issues. So it's a more overall whole view of their mouth as it relates to systemic health and other issues that they may be having.
Mm-hmm. And as we were preparing for this interview and for the Women in Wellness presentation in the magazine and on our website, you've mentioned that you consider yourself a physician of the mouth. And you've got a very impressive background. You're an integrative biological dental medicine board certified naturopathic physician, and many of your other certifications. And you're also the current president of the Holistic Dental Association. So
Yeah.
all of this tying into a different type of physician. So go ahead.
Yeah. So, well, in medical school, general medical doctors are not given any training with the mouth. And so they may look into the mouth and take a look and see if your tonsils are enlarged, but they don't have any idea what's going on with their teeth. It's just not part of their training. Same thing with like nutrition. It's not really part of their training. So we, as biological holistic dentists, we take a look at the mouth because the mouth is the gateway to the body. It's the start of the digestive system. It's all one tube. It's all, the same cells. It's all related.
Yeah.
And so we're really able to make a big difference with patients by seeing what's going on in their oral health, and thus it impacts their overall health. So
Yeah.
we are physicians of the mouth. We're not just tooth mechanics.
Yeah.
So don't just go in there and drill a tooth and fill it up and that's it. Because that, for some people and some traditional dentists, that's what they do. They see a cavity, they fill it, and
Mm-hmm.
on to the next patient.
Yeah.
For us, we go into a lot more. We go a lot more in depth.
You're looking at the
We
whole.
want to see. Well, we want to take a look at the root cause of the problem too. So if there's people who are consistently getting cavities, or even if I have a new patient with a lot of decay, we take a look and see what kind of decay is it? Is it on the top of the teeth, or is it in the roots of the teeth, or is it in between the teeth? And that tells me about, do we have to talk about diet, or do we have to talk about brushing? Do we have to talk about the times of the day that somebody's eating, or let's talk about their pH levels.
Mm-hmm.
Let's talk about, there's so much into nutrition, and what are you eating? There's a lot that goes into that. So we try to figure out what's the root cause of the cavities, what's the root cause of the periodontal disease or the gum disease.
Mm-hmm.
Why is somebody getting these problems? So I like to teach patients to help them take care of their mouth, help them take care of their body, and to help them keep their teeth for as long as possible, forever, hopefully. We see patients of all ages. We'll see them as young as a few days old. We'll see infants for tongue ties or frenectomies, all the way up to patients in their 90s. So we'll see patients of all ages, all age ranges, it's pretty amazing to be a part of their health journey throughout their life.
What types of things are you seeing very specifically with women's health? Are there health concerns that women tend to have more related to dental issues than men do?
I would say a lot of women are coming in when they're filling out their medical history. What I'm seeing a lot recently is a lot of thyroid issues, a lot of anxiety, and a lot of sleeping issues unrelated to waking up for babies. So I see that a lot. And sometimes thyroid issues could be something that's in the mouth. It could be like an endocrine disruptor. Could be certain materials that are in their mouth, certain plastics in the mouth. There could be something in that realm that we deal with. Um, and we see a lot of women who just are not rested. And so they'll get their 6, 7, 8 hours of sleep every night. But they're tossing and turning. They wake up tired. They're tired throughout the day. And so we do a lot of sleep testing.
Okay.
And that lets us know if there are some type of sleep related breathing issues that are underlying. And so for some women, it, could be, there's different levels. And so for some people, it could be something like sleep apnea. And so we generally think of sleep apnea as large older males of having sleep apnea, but there's a whole subgroup of petite women who are, and young too, that are having either some type of obstructive sleep apnea issue or upper airway resistance syndrome issue, some type of breathing issue that's preventing them from sleeping well and preventing them from actually getting a restful sleep and just thriving.
Yeah.
And there's a whole gamut of kids too that we're testing as well.
So during the pandemic, did you notice any new things or maybe more common things happening with people's dental care?
So throughout the pandemic, I noticed a lot of teeth fracturing. So there's a lot of stress. So people come in with broken teeth, fractured teeth, a lot of grinding, a lot of jaw pain. So I think there's just a lot of like stress and tenderness that's happening. That I would say that would be the biggest issue that we were seeing at the beginning stages. And now when people are getting vaccinated, we've seen a lot of like aphthous ulcers, canker sores, a lot of canker sores right now coming out after people will get the vaccine, and then right away they'll get some type of reaction like a canker sore. Sometimes they'll have some pain in certain teeth that will come and then will go away. And that's been interesting to see too. So we've been tracking our patients, seeing who's gotten COVID and what their symptoms are, and who's gotten the vaccine, what their symptoms are. And so we've been doing an interesting job just tracking other people's symptoms.
And what about for people who during the pandemic just, didn't go and have dental checkups, didn't go and have any work? What are the main concerns with that?
We're seeing a progression of gum disease. And so there's definitely people who have not gotten a cleaning, and their gum disease has worsened, because these are the people who are also coming in every 3 months and they haven't been in over a year.
Yeah.
And so those are the people who are seeing that they're struggling in that sense.
Yeah. So they should be trying to get in.
So at this point in COVID, there's enough protocols in place at most dental offices that it's very safe to go to the dentist. So I don't think anyone should really fear going to the dentist or feel unsafe going to the dentist. Between the filters that we have and the different suctions and the aerosol eliminating devices, I know that our office has special PPEs that we wear, and making sure that the hallways are clear and only one patient in the waiting room and one patient in the room. And so I think it's very, very safe for patients to visit the dental office. I don't think anyone should fear that at this point. So go get your cleanings and checkups.
Yes, before it becomes a problem.
Exactly.
So Dr. T, let's talk a little bit more about your own personal philosophy and what keeps you going every day and what keeps you passionate about being a dentist. And I want to look at a quote that you had shared with us as we were preparing. Life doesn't happen to you, but for you. Be open to possibilities. The body can heal itself when given what it needs.
So there's really two quotes that I really like that I tended to combine. And I really believe that life happens for our benefit. So there are things in life that happen, and I'm a business owner. I'm not just a dentist. So I wear many, many hats. I'm a mom, I'm a wife, I'm a daughter, a sister. Many of us wear these types of hats. And I think that there are things that, especially running a business, there's turnover. There's people who leave. An associate is leaving, and it's an awful experience. Nobody wants her to leave, but she's moving. And I've had assistants who've had babies and left and never came back, and we never really like that because they're part of our family. And so there's change that happens, but I feel like if we know that that's for the best, because something better is coming for us. And I think that I take that into my personal life, I take that into my business, I take that into my health, and even things that we think about that this is the worst thing that can ever happen to me. I like to figure out, but what is it trying to teach me? Or what do you think I'm going to get out of it? What can I do because of that? So I really think that the world works in my favor. And I always try to figure out, even if I don't figure it out, it's always knowing that I will know one day that it happened for the best. And I think the body is able to heal if we're given the right resources, if we're giving it the right resources. Mm-hmm. In my practice, I've really seen a big difference when patients are taking their health into their own hands. And I've seen different diseases reversed, periodontal disease, gum disease, cavities reversed. I've seen people curing their own cancer. I've seen people curing their own Crohn's and IBS and various digestive disorders, various allergies. And I really do think that if we are giving the body what it needs, it will maybe cure or treat the conditions. And so I'm a big believer in trying to figure out what it is that our body needs. And I think that the body will do the rest. And I've seen spontaneous healing. So it's pretty amazing to be a part of it.
So Wrigleyville is located in Chicago. And as we're coming out of the prior phases and moving into the next phase of recovery, or whatever you want to call it in Illinois, what's next for Wrigleyville Dental? What are you adding? What are you doing this summer, this fall?
So we're adding new doctors to our practice. So we're going to be adding 2 new doctors to our practice. We're always adding new technology, new techniques, sometimes even new materials, depending on what's coming out into the market and what is tried and true and tested and works for patients and helps people heal.
Well, great. Thank you so much, Dr. T. So if people want to find out more and connect with you, what's the best way to learn more about Wrigleyville Dental?
You can email us at info@wrigleyvilledental.com. You can go onto our website. Actually, that's a new thing, or we have a new website coming up in the next couple of weeks. There's going to be a chat tool. You can chat with us through there. You can send us a message on Facebook. We're on Instagram. So we're trying to grow our social media presence as well. So you can just call our office as well.
And your office is located where?
It's in the Lakeview neighborhood, or Wrigleyville area neighborhood. It's on Ashland, 3256 North Ashland. So it's between Belmont and School Street on Ashland, kind of near that Target, near the Whole Foods.
Mm-hmm. Oh, great. Well, thank you so much, Dr. T. I've really enjoyed talking with you this afternoon, and continued success at Wrigleyville Dental.
Thank you so much, Peggy.